Hello, this is my PowerPoint presentation on attention deficit hyperactivity disorder, ADHD. And the reason I thought it was important to present on this topic is because I've been working with the ILRD, which is the Interactive Learning Response Document, and I think that this tool would be a great tool to use with students with ADHD. What is ADHD? It's a persistent pattern of inattention, hyperactivity, impulsivity, or both that are more frequent and severe than typically observed in individuals at a comparable level of development. The school setting requires children to listen quietly, sit still, follow instructions, pay attention, and concentrate. Those are all things that are very hard for the ADHD student. Some of the symptoms: difficulty paying attention, frequently daydreaming, difficulty following through with instructions and not listening, problems with organization skills, easily distracted, difficulty remaining in their seat, frequently fidgeting or squirming, runs about or climbs inappropriately or excessively, has trouble waiting his or her turn, excessively talks, and will intrude others' conversations. ADHD is 3 times more prevalent in boys than girls, and about 11% of children between the ages of 4 and 17 have ADHD. Some of the causes and risk factors. There are no clear-cut causes of ADHD, but they found that it can be related to some of these risk factors. If you have a blood relative with ADHD or other mental illness, exposure to environment toxins, maternal drug or tobacco or alcohol use, or premature birth. Accommodating students with ADHD. Use warning signals. So whether it's a tap on the desk or eye contact, make sure that the student understands that you're trying to get their attention. Constant praise for quality work. Seat the children away from the window so they're less distracted. Help with organizational skills. Make sure everything is laid out perfectly on the board so that the students constantly know what they have to do. Arrange desks in a row. Try to stay away from grouping desks together because that will cause attention problems. Give instructions slowly and one at a time. Use plenty of visuals and use short quizzes instead of long tests. Strategies for teachers. Use a cue to grab the student's attention when starting a lesson. List the activities of the lesson on the board. Tell students what they're going to learn and what you expect from them. Establish eye contact. Allow for frequent breaks. Summarize key points. Repeat yourself as often as necessary. Do not make the student publicly answer a question that may be too difficult. It's a collaborative effort to teach students with ADHD to their full capacity between parents, teachers, students, counselors, doctors, and any other important person in their lives. No 2 students are the same. It's our job as professionals to recognize the appropriate accommodations each student may need. Differentiating instruction for any student is important, whether they have ADHD, another disability, or no disability. I find that the most important things to differentiate are the curriculum, the delivery system, which is where the ILRD comes in, and the environment. Differentiating the delivery system. Students with ADHD who learn auditorily will be engaged through reading of text and verbal instructions. Students who are visual learners will benefit from written instructions. Students who are kinesthetic will benefit from writing out the answers to problems. Students who are tactile learners will benefit through using foundations. Differentiating the environment. Seat these children away from the window. Sometimes dimming the lights will help. Use bells for gathering sounds. No clutter on the board. Plenty of visual aids and grouping as long as they're not distracted by it. For certain lessons, you can differentiate the curriculum using the students' rating levels and interest in the subject matter. Some students can be evaluated when they participate, but others don't participate. So therefore, their final product will be assessed. If I know a student is, let's say, interested in poetry, I will ask them to do work in this subject area that is higher than a student would be normally. So teach according to what motivates the child. That's it. Thank you very much.